You think your health insurance is a safety net? Look at the math. For the average American family, monthly premiums have become a hidden, mandatory tax that's liquidating your wealth, whether you ever get sick or not. In the last decade, premiums have outpaced inflation by 300%. You're paying for a gold tier plan with a deductible so high you're still paying out of pocket for everything. It's a system where the insurance companies win the moment you sign the check. In this video, I'm deconstructing the premium-to-payout math to show you how the insurance matrix keeps the middle class in an expensive prison. I'll show you the numbers they don't want you to see, and how to actually protect your capital. Let's look at the math. Welcome back to the FinRadius USA. If you want to protect your labor value and insulate your family's future, subscribe right now and hit the bell. Let's begin by exposing the primary illusion: why health insurance is no longer true insurance. True insurance is designed to protect against rare, catastrophic events, like your house burning down or total auto loss. You would never expect auto insurance to pay for your routine oil changes, wiper blades, and weekly gasoline refills. But modern health insurance has morphed into a mandatory third-party prepaid maintenance subscription for everyday life. Because every minor doctor visit, blood test, and generic prescription routes through a bureaucratic claims processor, the system has added 3 layers of administrative overhead to every single healthcare transaction. Here on the FinRadius USA, we call this the third-party payer distortion. When neither the patient nor the doctor knows the cash price of a procedure, market pricing breaks down completely. Hospitals artificially inflate ChargeMaster list prices by 500% so insurance companies can claim a fake discount. Now let's calculate the brutal math of loss on a standard family healthcare plan in 2026. The average family health insurance premium now totals $24,000 per year. Even if your employer covers 70%, that money is simply deducted from your total compensation package before you ever see it. You pay $7,200 directly out of your paycheck, while $8,000 in employer money is silently diverted. On top of that $24,000 premium, the average family plan carries an $8,000 annual deductible. If your family faces an emergency, you must spend $8,000 of your own after-tax cash before insurance pays a single dime. Add co-pays, co-insurance, and out-of-network exceptions, and your family's annual exposure reaches $35,000. For a family earning $100,000 gross, health insurance consumes over 35% of total production. You are working from January until May every year simply to pay for the privilege of having a plastic health insurance card. But the direct premium cost is only the initial layer of financial liquidation. The true wealth killer is the catastrophic lifetime opportunity cost of those redirected premium dollars. Let's calculate what happens if a healthy family redirects just $1,000 of monthly premium into real productive assets. Over 30 years of working life, that $1,000 a month equals $360,000 in direct cash outflow. If that exact same $1,000 were invested monthly in a broad market S&P 500 index compounding at an historical 10%, that capital grows into over TWO million, TWO $100,000. You surrendered over $2 million in retirement freedom to protect against medical costs that average less than $5,000 a year. Even if you faced a major $50,000 medical event twice in your lifetime, you would still be ahead by over $2 million. Dr. Evelyn Vance breaks down the regulatory mechanism that guarantees premiums will rise forever, the 80/20th rule. Under federal law, health insurance companies are required to spend at least 80% of premium revenues on medical claims. That sounds protective, but look at the perverse corporate incentive it creates. If an insurer spends $80 on healthcare, they can legally capture $20 in profit and overhead. How does the insurer double their profit to $40? They cannot simply raise profit margins. They must double total healthcare COSTS to $160. The law literally incentivizes insurance companies to encourage higher hospital prices so their 20% profit slice grows larger. Insurance companies and corporate hospital monopolies are partners in the same extraction engine, and working families are the involuntary source of fuel that keeps the corporate machine running. Furthermore, having insurance no longer protects you from medical bankruptcy. Over 60% of all personal bankruptcies in America are tied to medical bills, and 78% of those individuals had Helch Insurance when they got sick. Insurers routinely deny 20% of all in-network claims using automated artificial intelligence algorithms. You pay thousands in premiums, and when you need care, an algorithm rejects coverage, leaving you with the bill anyway. You are paying for the illusion of security while carrying all the underlying financial risk. If you are gaining actionable clarity from this quantitative analysis on the FinRadius USA, take a moment to subscribe, like this video, and hit the notification bell so you never miss an archive breakdown. Leave a comment below with your monthly health insurance premium. We read and analyze every single response. Now, let's reveal the exact 3-step strategy to escape the health insurance trap and insulate your family's capital in 2026. Step 1. Transition to a high-deductible health plan paired with a maxed health savings account. Drop expensive, low-deductible plans that charge exorbitant premiums for routine care. Switch to a high-deductible catastrophic plan, reducing your monthly premium by $500 to $800. Redirect every single dollar saved on premiums directly into your health savings account. The HSA is the single most powerful tax shelter in the entire United States Internal Revenue Code. It possesses a triple tax advantage. Contributions are 100% tax deductible, growth is completely tax-free, and withdrawals for qualified medical expenses are completely tax-free at any age. In 2026, a family can contribute up to $8,550 per year into an HSA. Invest those HSA funds inside a low-cost S&P 500 index fund rather than leaving them in cash. In 15 years, your HSA compounds into over $250,000 in tax-free medical wealth. You have built your own private healthcare reserve fund, completely eliminating deductible panic. Step 2. Decouple routine care and adopt direct primary care. Direct primary care practices operate outside the insurance matrix entirely. For $70 to $100 a month per person, you get unlimited primary visits, direct doctor cell phone access, and wholesale labs. A standard blood panel that costs $1,000 through hospital insurance billing costs $25 cash through DPC. Routine generic medications that carry $50 pharmacy copays cost $4 wholesale through a dispensing physician. By pairing direct primary care with a high-deductible catastrophic policy, you get superior healthcare at half the price. Step 3. Deploy the cash pay negotiation protocol for specialist care and imaging. If you need an MRI, Connecticut scan, or outpatient procedure, never run it through your insurance deductible blindly. An MRI billed through insurance routinely costs $2,500 applied to your deductible. If you call an independent imaging center and ask for the cash pay self-pay rate, that exact same MRI costs $350. Medical providers offer massive discounts for cash because they eliminate billing departments, claims, rejections, and 90-day payment delays. Always demand an itemized bill with CPT billing codes before paying any hospital invoice. Demanding an itemized bill instantly removes unbundled charges, inflated room fees, and redundant line items by 30 to 50%. Now let's examine the 4 hard asset pillars recommended by the FinRadius USA to redeploy your freed healthcare margin. Once you reduce your healthcare drag by $1,000 a month, that capital must be routed into wealth engines. Pillar 1. Total market equity indexes inside your HSA and personal brokerage accounts. Productive corporate equities capture GDP expansion and protect against ongoing currency debasement. Pillar 2. Physical monetary gold bullion stored in private non-custodial custody. Gold anchors purchasing power across decades, providing liquid reserve security independent of banking systems. Pillar 3. Digital scarcity via Bitcoin and decentralized self-custody protocols. Bitcoin provides a mathematically capped asset protocol with an absolute hard limit of 21 million units. Pillar 4. Cash-flowing productive assets and real estate infrastructure. Julian structures his capital across all 4 pillars, transforming former premium waste into an unyielding family balance sheet. Sarah backtests the lifetime wealth trajectory of a family utilizing the HDHP/HSA direct care model versus traditional gold plans. The data proves the self-directed family accumulates over $1.8 million more in net worth by age 65. Breaking the health insurance trap requires understanding that health and wealth are both personal responsibilities. Prioritize preventive metabolic health, clean nutrition, and daily physical discipline to eliminate systemic healthcare dependency. The best healthcare plan in the world is a strong, resilient body that rarely needs the medical matrix. Here is the final execution checklist from the research team at the FinRadius USA. Checkpoint 1. Calculate your true total annual healthcare drag, including premiums, deductibles, and employer salary reductions. Checkpoint 2. Switch to a high deductible plan, open and max an HSA, and enroll in a direct primary care practice. Checkpoint 3. demand cash pay discounts, and itemized billing codes for all specialist care and imaging. Subscribe to the FinRadius USA to join our community of sovereign allocators taking back control. Math deletes institutional dependency. Stay disciplined, stay insulated, and we will see you in the next decoding breakdown.